All right, welcome to The Explainer. Today, we are diving into a topic that is absolutely crucial for every single nursing student. We're talking about drug and supplement interactions. And trust me, this is the high-yield info you'll need for your exams and, more importantly, for keeping your patients safe on the clinical floor. So let's just jump right in with a question that really gets to the core of why this is so important. Could a simple, healthy herb actually put your patient at risk for something as serious as serotonin syndrome? The answer? A big, resounding yes. Let's dig into how. And this right here, this is a massive challenge you're going to face pretty much every day. So many patients take supplements, and they operate under this belief that if it's natural, it has to be safe. As their nurse, you are the one who needs to know that is absolutely not always true. This quote from our source material just nails it. Natural does not mean safe. Your knowledge, what you're learning right now, is literally the safety net between a patient's good intentions and a potentially dangerous outcome. So let's put that knowledge to the test. Okay, so to see how this all plays out, let's work through a case study. This is exactly the kind of situation you will find yourself in where all that textbook learning suddenly becomes very, very real. So here's your patient's medication list. You've got warfarin, an anticoagulant, duloxetine, an antidepressant, and diphenhydramine, an antihistamine. Pretty standard stuff, right? But then during your assessment, your patient casually mentions, "Oh, I just bought some herbal supplements to help me with my mood and sleep." That is your cue. That's when your nurse brain needs to kick into high gear. Okay, let's decode the potential interactions for this specific patient. We're going to focus on the big ones, the supplements that you'll definitely see come up on the NCLEX and even more often in your actual practice. First up, St. John's wort. You've probably heard of this one, right? It's incredibly popular for depression, but don't let its popularity fool you because it is famous or maybe infamous for causing some really serious drug interactions. And here is where it gets scary. Our patient is on duloxetine, an antidepressant that works on serotonin. Well, guess what? St. John's wort also increases serotonin. When you combine them, you can push those serotonin levels way too high, leading to serotonin syndrome, which is a life-threatening emergency. You'd be looking for things like agitation, a super high fever, and rigid muscles. Okay, next on our list is valerian root. This is another super common one that your patients might be taking, usually for anxiety or to help them sleep. And again, on its own, it seems harmless enough. But remember our patient's med list? They're taking diphenhydramine for allergies, which we all know can make you drowsy. Valerian is also a sedative. So what happens when you combine them? You get this additive effect, right? You're piling one sedative on top of another, which can lead to dangerous CNS depression. We're talking extreme sleepiness, confusion, and even a slowed breathing rate. Now let's talk about the biggest red flag on our patient's medication list, warfarin. This is a high-alert medication for a very good reason. And just look at this list on the slide. We're talking about common things like garlic, ginger, even chamomile tea. All of these can significantly increase the risk of bleeding for a patient taking warfarin. And the danger zone doesn't stop with herbal products. It's not just about teas and roots. We also have to be on the lookout for interactions with common vitamins and minerals, especially when a drug like warfarin is in the picture. All right, time for a super quick physiology refresher. Remember, your body handles vitamins in two different ways. You've got your water-soluble ones, like B and C, which your body uses and then gets rid of pretty quickly. But then you have the fat-soluble vitamins, A, D, E, and K. These guys get stored in your fatty tissues, which means they can build up over time and have a much bigger, longer-lasting impact on how drugs work. Which brings us to this, the absolute classic interaction that I can almost guarantee you will see on an exam, warfarin versus vitamin K. Think of it like this. Warfarin's entire job is to block vitamin K to prevent clots. So what happens if your patient suddenly starts eating a ton of leafy greens or takes a vitamin K supplement? Well, that vitamin K can completely override the warfarin, basically making the drug useless and putting your patient at a huge risk for a stroke or another dangerous clot. Okay, so you have all this knowledge now. What do you actually do with it at the bedside? Let's walk through a super simple 4-step action plan to keep your patients safe.
This is your patient safety checklist. Memorize it. First, you have to ask. And don't just say, are you taking any other medications? You have to be specific. Are you taking any herbs, vitamins, teas, or powders? Second, investigate. Never ever guess. Pull out your drug guide and look it up. Third, educate. Explain the risks to your patient in simple, clear terms they can understand. And finally, number 4, document everything. If it wasn't documented, it wasn't done. This is the bedrock of safe nursing practice.
I really want this to sink in. Never, ever underestimate your role in this. You are the one at the bedside. You are the final checkpoint before that medication is given. Your knowledge and your vigilance are the #1 line of defense in preventing a serious and preventable adverse event. So I want to leave you with this question to think about as you go on with your studies. What was the most surprising thing you learned here? Was it that St. John's wort could cause a medical emergency, or that something as simple as ginger could pose a bleeding risk? Thinking about that wow moment will help lock this crucial information in your brain. Hey, if this explainer helped clear things up for you, do me a quick favor and hit that like button. And better yet, share it with your nursing school study group. I guarantee if you found this helpful, they will too. And of course, make sure you subscribe to our channel so you don't miss out on any more of these essential nursing explainers. And one last thing, if you're looking for more great resources to help you totally ace your exams, be sure to check out the links down in the description. We've put together our top-rated, summarized NCLEX revision guides just for you. Thanks for watching, stay sharp, and go make a difference.